Hello, my name is Pat Turner. I am the CEO of the National Aboriginal Community Controlled Health Organisation, NACCHO, and the lead convener of the Coalition of Aboriginal and Torres Strait Islander peaks organisations. The Coalition of Peaks are Aboriginal community controlled organisations, and we are in partnership with all governments in Australia to work on closing the gap. Foremost though, I am an Aboriginal woman, the daughter of an Arrernte man and a Gurindji woman. I acknowledge the lands of the traditional custodians of the lands where we are meeting today. My speech is being recorded from the lands of the Ngunnawal people, and I pay my respects to the elders past and present and thank them for their continuing openness to have us live, work and meet on their land. I acknowledge that the conference is being held on the traditional lands of the Gimi Walbara Yidi people. I apologise if I haven't pronounced that correctly, but I pay my respects to their elders too. Over the past 50 years or so in Australia, we have seen the momentous changes in Aboriginal power, leadership and impact. As a country, we have had our ups and downs as we try to forge more authentic, equal and effective partnerships between Aboriginal, Torres Strait Islanders and non-Indigenous Australians. I am optimistic and I believe that we are on the precipice of a national reform agenda. This impacts on the important work carried out by Aboriginal and Torres Strait Islander nurses and midwives every day across Australia. You are experts in your field and you are valued very much for the work that you do and the lives that you rebuild every day. You know your patients and you know your communities. This connection has allowed us to protect our people in these uncertain times, and we will always continue to do so. Together, we are changing the way Australian governments work with our people. As community-controlled organisations, we work for and are accountable to our communities. We share a belief that Aboriginal and Torres Strait Islander people must have a meaningful say on policies and programs that impact on our lives through formal partnerships with Australian governments at all levels. It is on this platform that the Coalition of Aboriginal and Torres Strait Islander peak bodies came together and formed a partnership with all Australian governments on closing the gap. This is the first time that Aboriginal and Torres Strait Islander peaks have worked together in this way. The Coalition of Peaks brought their own political agency to the table and through a negotiated formal partnership arrangement with governments have agreed a new national agreement on closing the gap, which came into effect on 27 July last year. The national agreement sets out how governments and the Coalition of Peaks will work together to improve the lives of Aboriginal and Torres Strait Islander people. The Coalition of Peaks is made up of over 50 national and state and territory community-controlled Aboriginal and Torres Strait Islander peak organisations. CATSINaM is a member of the Coalition of Peaks and provides valuable advice and support for the national reform agenda we are undertaking. CATSINaM is working every day to address the priority reforms outlined in the national agreement. Formal partnerships and shared decision-making, building the community-controlled sector, transforming government organisations, and shared access to data and information at a regional level. CATSINaM is also working hard every day to address outcome 2 of the national agreement. Aboriginal and Torres Strait Islander children are born healthy and strong. Importantly, Target 2 sets out a vital goal that by 2031, the proportion of Aboriginal and Torres Strait Islander babies with a healthy birth weight will be increased to 91%. I acknowledge the work of every Aboriginal and Torres Strait Islander nurse and midwife who is striving to achieve this target and to give our kids a much better start in life. NACCHO continues to advocate and support our Aboriginal community-controlled health services in providing comprehensive primary health care to all our people across the country. Together, we are changing the way governments work with our people on health policies and programs that impact on us. We will continue to advocate and hold governments to account to close the gap in health equity. We have the policy platform, we have the commitment. We are seeing some investment, but there is much more to do. Our people are on a healing journey. The impact of intergenerational trauma, beginning with colonisation, continue to result for some of our people in disconnection from family and culture. Our Aboriginal and Torres Strait Islander nurses and midwives are often the first people to address the healing journey for our people. You all work across many areas in Aboriginal and Torres Strait Islander health, from hospitals to prisons, in our community-controlled health services. You are constantly supporting and growing our workforce and strengthening cultural safety wherever you work. ACCHOs came into being because of the inability of mainstream health services to engage Aboriginal communities with their services. Our ACCHOs are more than just another health service. They put Aboriginal health in Aboriginal hands. The first Aboriginal medical service was established in Redfern in 1971, 50 years ago. Our roots are deep. We have endured as a high-quality, clinically accredited, community-controlled service for 50 years. As the health service becomes more complex, the role of our services becomes even more critical. The Aboriginal and Torres Strait Islander population is increasing rapidly, and funding levels have not kept pace with demand. Our community-controlled health services are best placed to advocate and work to overcome the cultural and social determinants of health, which can hinder Aboriginal and Torres Strait Islander people's accessing the healthcare they need. There is a clear preference for Aboriginal and Torres Strait Islander people to access community-controlled services, and many will bypass mainstream services to access one where they know they are confident their cultural safety is guaranteed. We build ongoing relationships to give continuity of care so that chronic conditions are managed and preventative healthcare is effectively targeted. I am so proud that the Aboriginal and Torres Strait Islander nurses and midwifery workforce continues to grow. Between 2016 and 2019, the total number of Aboriginal and Torres Strait Islander nurses and midwives with general or provisional registration increased from 3,677 to 5,037, a compound annual growth rate of 11.1%. Well done. The number of employed Aboriginal and Torres Strait Islander nurses and midwives increased from 3,202 to 4,639 over the same period, a compound annual growth rate of 10.9%. The number of employed Aboriginal and Torres Strait Islander nurses and midwives who worked as clinicians increased from 41.4% from 2,838 to 4,012 over the same period, a compound annual growth rate of 12.2%. Wonderful. NACCHO supports CATSINAM's commitment to develop and support recruitment and retention strategies for Aboriginal and Torres Strait Islander people in nursing and midwifery. I acknowledge the challenges faced by Aboriginal and Torres Strait Islander nurses and midwives: cultural isolation, cultural load, and a lack of cultural safety in some settings due to racism. I acknowledge the feeling of stress that these challenges could cause. You all need to be supported, and we all need to keep working to create and sustain structural change. So I leave you all with a lesson I learned from my uncle, the late Charles Perkins: to stand up for what you believe is right and to seize the opportunities you have. Thank you very much.